Good evening, ladies and gentlemen, boys and girls. I say that boys and girls. But anyhow, good evening, ladies and gentlemen. Welcome to another edition of the Grand Boulevard Prevention Show. This is a drug free community show. We're going to be dealing with issues of drug free communities and prevention of drug and underage drinking and marijuana in the Grand Boulevard community. That's going to be the topic of discussion. I should have you know that February is National Teen Dating and Violence Awareness Month. Again, February this month is National Teen Violence Dating and Violence Month. This is a live show. 312-738-1060. 312-738-1060. This is a live show, interactive show, so join in the conversation. We are talking about drug-free, having drug-free communities, and what does that mean? I have some very exciting, so I didn't have a guest this week because I have some very exciting information to share with you. I've just come back from Washington, D.C. On a 4-day trip there at a CAC conference where I met with individuals from across the United States who are and coalition members from across the United States who are doing the very work that we're talking about or going to be talking about and addressing today, and that is how do we prevent drugs and alcohol from getting into the hands of minors in our community. But we're also going to be talking about prevention and preventative measures and how do we address that. So before we get started, as I always do, I like to acknowledge our members of the Grand Boulevard Coalition. We have Recovery 2000. I'm the executive director, Ms. Izetta Walton. We have the Centers for New Horizon. Ms. Krista Hamilton is the executive director of Centers for New Horizon. We have the Institute for Positive Living. Reverend Maurice Coverson is the executive director of that organization. We also have our business sector partner, and Mr. John Cook, who is the owner of the Bronzeville Community Clubhouse. We have the Chicago Public Schools on board as our educational partner and liaison. We have Greater Harvest Missionary Baptist Church, where Pastor Eric Thomas is the pastor, who is our religious sector-based partner. And we also have for all purposes, I should say, nothing can be done without having our civic and government engaging partner. And right now, that's the Third Ward Alderman, Pat Dow. Of the Alderman of the Third Ward. So again, this is a live show. 312-738-1060. You can give us a call and let's have a conversation about drug-free communities. Again, I just came back from a conference and a CACA conference. And CACA was the overarching organization, but then we had SAMHSA, which is the substance abuse and mental health. I'm gonna get this right: substance abuse, mental health service administration. Short on titles a little bit, tie tongue. I met with probably I got a chance and opportunity to interact with more like around 30 different community coalition organizations. Most of them were rural, who are struggling, not like our community. And when I say rural, those are communities that are not in major cities. There are a lot of woods. They don't have the level of density with a lot of housing. Is scattered and very white, if I might add you. And so their issues are alcohol, but it's meth and heroin, right? And as you know, you've been hearing a lot about this heroin epidemic and craze that is happening in the northern suburbs, suburban communities. And I was all I was. It's not a joking matter, but I made it a joke that in the black community we don't have a heroin using problem. We have a heroin selling problem. But we do have an adult population that engage in the use of heroin. But I see we got a caller. Caller, you on the air. Good evening, caller. You on the air.
Hi, I've watched the show before, and I know that one of the things that people have mentioned contributes to violence in the community as drug use is the lack of education and the lack of jobs. So I was just wanted to hear your take on the new confirmation of Secretary of Education Betsy DeVos and how you think that that's going to affect the education here in Chicago.
Oh, why would you put me on the spot? I want to stick to. Well, thank you for your call. Listen, I would just say this, and this may shock a lot of people. It may not. I really truly don't have an issue with Secretary DeVos at this point. I'm willing to give anyone and everyone an opportunity. Now, yes, it's true she's never taught school, but neither did Arnie Duncan, who's the former head of Chicago Public Schools. It's true that she's never been in administration, at a educational administrator. That she's some wealthy billionaire woman who's friends with Donald Trump, and that's how she got the job. Well, Arnie Duncan was an administrator, and well, I'll as you can tell, how did the Chicago Public Schools end up? So I don't want to get into the political ruckus about Mr. Trump and his appointees. I have some grave concern, especially at the end of the day, and I'm speaking as a black man who do this work as a member of this Grand Boulevard Coalition and a community organizer and a father and a resident of the black community that has the highest unemployment rate in the nation here in Chicago. That, and I talked about this last week, that black teens and in some of these most violent communities, the unemployment rate is somewhere between 67 to 70% amongst teens 16 to 24, and black adult unemployment numbers are somewhere around a staggering 26% nationally. But again, here in Illinois, Chicago, we have the highest unemployment rate among African Americans. So the best way for me to answer your question, and even after spending some time on the Hill and meeting with some senators and congressional staffers, listen, I think the Trump administration gives a lot of folks some reason to concern based upon their lack of not being politicians, right? I get that, and the fact that he's filling his cabinet up with a bunch of billionaires and people who don't have positive track records. But the things that I just mentioned happened over the last 8 years. So all I'm saying to you is that I think at this point it's all hands on deck. We're going to have to push back. We're going to have to fight. And I'm willing to give the folks an opportunity. Much of the preventative stuff that I'm talking about here, this SAMHSA and the CACA and these coalitions, the vast majority of their funding and support have come from Republicans. And believe it or not, Senator Mitch McConnell and Paul Ryan, if I may just be political for a moment, are two of the biggest pushers of this program. Now, I'm not naive. As an organizer, I understand that rural white communities have a greater problem as it relates to dealing with drugs. When I say a greater problem, I mean that they're dealing with the use, the consumption of alcohol and crystal meth and heroin. I mean, that's real serious among their teens. Now, moving over to the African American side of this issue, or even Latino side of this issue, our issue is more with marijuana among teen youth, right? Marijuana, popping pills, which I think has the same adverse effect as a young Caucasian person shooting heroin, in my opinion. But popping pills, drinking syrup, and even now, today, because they can't get the liquid codeine, they're turning to the medicine cabinet, right? So I would warn parents tonight to be careful, or I should say watchful, of the Benadryl, the NyQuil, the 44D. I'm just naming cough syrups in general, or pain medication. Just be careful and mindful of your young person maybe wanting to experiment with that over-the-counter medication and mixing it with Sprite or orange soda. I heard a lot about that. But back to, so caller, I hope I answered your question. Just touch on it. I'm willing to give Ms. DeVos an opportunity. I support public education, but I also believe in a parent's right to choose. Most of my children have attended public schools. I've only had one in a charter school and one in a private school, and but the vast majority of it, and all my work is through public education. So I'm not knocking against public education. We've got great partnerships with the public schools, and I don't have a problem with it. And I would fight against anyone trying to further destroy public education. But on the other side, we all got to be accountable. Even, listen, the work that I'm doing and the other partners that I just talked about in the social service arena, we all have to be accountable, and there's got to be checks and balances to it. So that's my answer, cut and dry. I probably spent more time on that issue than I necessarily wanted to. But getting back to this coalition and the conference, I had an amazing time, an amazing ability meeting with urban coalitions. Now, so out of all of these SAMHSA programs, or what they call DFCs, I had the opportunity to meet with roughly 20 groups of African Americans who are doing this work across the country. Now, in Chicago, we have four organizations who are doing this work. I believe, and I've had some of them on. We've had them in West Garfield. I hope he doesn't kill me. Reverend Walter Turner, Walter, who I Walter Turner. That's New Spiritual Light, Reverend Walter Turner on the east side, 40 and slip. But Fathers Who Care is in the West Garfield community stakeholders, who has a show on CAN TV that'll be coming online. He probably won't be here, but some of his young people will be sitting in for him, who is doing the work in. So we got in Garfield, West Garfield Park, and we're in Grand Boulevard. And we're looking to organize and mentor other groups who are trying to come on board to do the same work. And again, it's about building relationships in the community through the businesses, through the schools, through the parenting, through the parents, and the community organizations to come up with a strategy and to heighten awareness around underage drinking and the use of marijuana among teens and young people in our community, and it's a big problem. It starts with the marijuana and the drinking, and then it leads to which many call gateway drugs, and which leads to other drugs. And if you're looking to reach us at the Grand Boulevard Coalition, I hope you can see that. It's the Grand Boulevard Coalition, 435 East 35th Street, Chicago, Illinois, 60616. And you can email us at grandboulevardcoalition@gmail.com. Again, it's 435 East 35th Street, Chicago, Illinois, 60616. Or you can email us at grandboulevardcoalition.com. You are watching the Grand Boulevard Coalition show that is brought to you by CAN TV. This is a live show. You can join me in the conversation, 312-738-1060. 312-738-1060. But back to the point. So at this conference, we had the DEA leadership speak. We had mental health experts speak. The head of SAMHSA came in, the undersecretary or acting undersecretary came in and spoke and talked about the efforts from the federal government. So what I'm saying to you is what I started out saying, that the federal government is still currently, according to the top brass who presented at this conference, is committed to levels of prevention and committed to the process and the work that we've been doing with these drug-free communities across the nation. And so it is, listen, I can't tell you that it's been an easy job trying to bring down the numbers. But we accentuate the positive and in the Grand Boulevard Coalition. And so we have a slogan that most youth don't use. And that is true. Most youth don't use, but far too many do. and because far too many do, we still have to stay on the wall, if you will, and continue to spread this message and bring this information out to you. And so it is not it's a kind of daunting, task, and sometimes even frustrating. But I will say this: the need for more urban coalitions, just from my assessment of it, and again, this is not to take anything away from any other community or try to take any resources from any other community. When you look at the long term, or should I say, the adverse effect of drug usage and drug selling, it has a much more negative impact on the African American community. We can all agree, and I can concede that whites use more drugs than African Americans. That's clear. So you don't have to make that argument with me. I'm clear about that, and that's because there's more of them in the country, in the United States than us. But when it comes down to the adverse effect of the usage of drugs and the abuse of alcohol among teens, our community, it has a much worse effect, and it causes irreparable damage that is hard for us to sometimes come back from. I mean, this thing becomes almost generational. So when you have young people who are at 12 and 13 years old smoking marijuana, then drinking alcohol, and then they grow up to be teens, and in many cases, their parents were more than likely drinking, and it's a term that they use, alcoholic fetal syndrome. So many of the parents were probably 1 or 2 months pregnant and had no idea that they were, and the child came out addicted to alcohol. And so as they got older, the parent thought it was okay and cool, because they were still struggling with their alcoholic demon, that to give their children alcohol, just not a good choice, not a good idea. And so the point that I'm making, and that out of the division of SAMHSA and in the federal government, what we want to try to do, many of us who are African Americans who form these community coalitions and are receiving funding, we want to broaden it and bring in more urban coalitions. Yeah, right. So forming more urban coalitions where there are community folks coming together in their particular neighborhoods, their geographical neighborhoods and boundaries, forming these coalitions to deal with this issue of underage drinking and smoking of loud marijuana amongst our teens, because we know that it is a gateway to a larger problem. And so there are roughly, off the top of my head, I believe somewhere near 100, at least they're represented at that conference. It was like maybe 126 groups, and out of the 126, there may be 20 urban coalitions. You heard it, 20. Yeah. And I believe, and don't quote me, I'll have the actual number next week, the federal government puts in about $90 million across the nation into this preventative work, right? And so when I tell you it's only 20 groups, and in some states, you have a larger African American population than we have here, like Florida, like Texas, Houston to be more specific, like Atlanta. But we can go right into Chicago, and I can tell you in some of those seven and most violent communities, they could certainly use the support of SAMHSA and a DFC partnership in Inglewood, in Roseland, in Austin. Those three communities, I think, in South Shore, they could certainly use this level of support based upon the statistics that are coming in. And the schools and education is definitely important. So I don't want to miss that. The partnership with the Chicago Public Schools, or partnership with schools in general, are very important. And I'll tell you why. Because that is where most of these young people get most of their they spend most of their time in one, I guess in one area, and I like to say they also get their most nutrients. And I'm not just talking about physical food. I'm talking about the level of educational of food that they're getting. Now, some would argue that they're not learning anything. I beg to differ. You have some sincere, hard working educators who are doing their best to try to educate our children. But, many of these kids come to school with a lot of different issues. One dealing with substance abuse issues, or their parents having substance abuse issues, or their poverty issues where the only meal that they get is the free breakfast and the free lunch, right? And so a lot of different attitudes, or they're dealing with these issues of molestation, incest. I mean, we can go on and on about the plethora of problems that these young people are getting, right? But if they're in a school environment 6 to 7 hours a day, dealing with an adult who has their best interests at heart, right? Several adults. They move around from class to class, right? And then you have administrators and you have counselors. And the board is looking to cut $46 million out of the school system. I don't know how that's going to work, especially for our young people. But that's due to a state issue where we haven't had a state budget for 2 years, which is shameful on the surface, I will say. But the point of the matter is the partnerships with the Chicago Public Schools are so very important. And we should be, as community folks, right, supporting our local educators and our local schools. We should be. Just as we should be trying to give support to parents. I think one of the toughest jobs today in this state, I would just say, just because of the unemployment issues that we like to gloss over, listen, our people are hurting. And the toughest job today is being an African-American parent, trying to be a parent. To a teenage child where you have social media, you have the outside external influences, but then you just have the daily struggles every day of trying to be a good parent and an involved parent. And in some cases, you don't get the level of support. I understand. I am a parent, so I understand how you can feel like you don't get support from others. But you got to hang in there and continue to do what you know that is right within you, and things will get better and it will pay off. But it's going to take all of us in this fight to deal with these issue of underage drinking, drugging, and even this issue of violence in our community. It is time that we have all hands on deck. So there's no wrong answer. I think whatever you find that you think is positive, if you can find 2 or 3 people that agree with you, then you guys come together, put a plan together, and begin to work it. I encourage parents to just go up to the school. If you are not working, you've been laid off and you don't have it, don't sit at home. Go to the school where your child is. I'm sure that the school would welcome your presence, another adult presence, if it's positive, in the school to help them with those children. They're telling me my time is getting short here. But listen, I don't think it's a time for us to get frustrated or to be worried because there's a new administration. I think what we need to do as citizens is to stay vigilant, get involved, join in a local community organization that is fighting for change. If you're in one of those communities I mentioned where there's a DFC, in fact, you can call us, call me, 312 420-5582, 312-420-5582, and get involved. Just don't sit on the sideline and complain. Get involved with change. Go to your local alderman's office. Find out who your state senator is, your state rep. Go to the local community organization that's having an after-school program. Volunteer. If you don't like what's going on at the businesses, go and tell them. You need to clean this up. This is not acceptable in our community. But till now, between now and next week, keep the faith. Thanks. It's been great.